Hello everyone. In this video, we will continue our next part on routes of drug administration. In the previous video, we talked about local route and the enteral route. In this video, we will focus on parenteral route. So parenteral route is a route by which the drug directly enters into the vessels, and the first pass metabolism, that means the metabolism of the drug as the drug enters into the liver, there the drug is metabolized, that is bypassed. So in parenteral route, we have two main methods, that is injectable route and non-injectable route. So in injectable route, again we have four different routes, that is intravenous route or IV route, intramuscular route, subcutaneous and intradermal route, and non-injectable we have inhalation, nasal and cutaneous. Now these inhalation, nasal, cutaneous we have dealt in local routes as well, but in that we were talking about that how these routes help the drug to reach the local area only. So the drug will remain in the nose area or in the sinus region or in the bronchus. But here we are talking that from these regions the drug will be absorbed in the systemic circulation and it will go to the target organ. So first we will talk about the injectable routes. So in injectable routes we have different routes as we said. So first is IV route. IV route is where the drug is given intravenously directly into the vein. So see this diagram. This is the IV route where we have to locate the superficial vein on the body, mostly in the arm, and the drug is injected into the vein directly. So for this, the syringe is kept at an angle of approximately 25 degrees from the skin. So in this, what is happening, that the drug is directly going into the circulation, so it has 100% bioavailability. That is a big advantage. So no variation in absorption of the drug from the GI tract, and after that no metabolism. Everything is going directly into the blood circulation. So that is 100% bioavailability. Second thing is that because we are injecting the drug, we get an immediate effect, and because of this it is the favorable route of drug administration in emergency conditions, because we want the immediate effect. Then highly irritant drugs can also be injected directly into the vein. Only one thing is there, that if the drug comes out, if there is leakage of the drug, then it can cause the damage to the nearby tissues and also can lead to thrombophlebitis. Then dose titration with response is easier. Dose titration with response means that how much dose is causing how much response, that can be easily changed because we are directly injecting into the vein. So if the response is lesser, we can increase the dose. So direct matching of the response with the dose can be done. Then there are certain disadvantages also. First, because the drug is directly injected into the vein, there are chances of infection. See, when we are giving the drug via the enteral route, then we have seen in the previous video that the drug passes through the stomach, and stomach has mechanisms where it can destroy the foreign substances. But in this case, if the drug is not sterile, in that case, there are chances of infection. Then there are also chances of air embolism. That means if the technique of giving the drug is not proper, then air bubble can go into the vein, and this air bubble, if large enough or the amount of air which enters into the circulation is more, it can go and block the pulmonary circulation, and ultimately it can affect the cardiac output, it can affect the oxygenation as well. Then next is there are chances of thrombophlebitis. Thrombophlebitis is a inflammatory condition where basically a blood clot, thrombus is blood clot, right? So blood clot forms in a vein. So this is inflammatory condition. So that is why phlebitis, itis word is used for inflammation. And next is that it is the most risky route. Why? Because whatever drug you are injecting, directly it will go to the various organs. So suppose if the dose is more or if the drug is harmful, then it can damage the organs directly. Okay, so that was about the intravenous route, especially very useful because of its use in emergency condition and because of 100% bioavailability. Now what are the drug forms, the drug dosage forms which can be given by IV route? That is the aqueous solution. Aqueous solution is given by IV route, remember that. Okay. Next, there is no depot preparation. Depot preparation. Actually, depot preparation is a preparation which is injected into the area, and from there slowly it is released into the circulation. For example, it can be used for intramuscular and subcutaneous route. So in these cases, the drug is injected here. It will be in the muscle, and here below there will be vessel. The drug will slowly go into the vessel. So it is like a slow sustained release of the drug into the circulation. But IV means all drug you are injecting directly into the circulation. Moving on to the next route of drug administration by parenteral route, that is the subcutaneous route. Intramuscular we will see in some time. So in subcutaneous route, the drug is injected just below the dermis. Skin has two layers, that is the epidermis and dermis. So just below the skin, that is subcutaneous. Subcutaneous means below the skin, the drug is injected into the subcutaneous tissue. And from there then slowly the drug enters into the circulation. So this subcutaneous route, what are the drug dosage forms which can be given? Well, aqueous solution can be given, and they can be depot preparations also. So that means the drug can be slowly released after injecting into the subcutaneous area. The drug will slowly enter into the circulation. Now, what are the advantages of this route? One, that self-injection is possible. Self-injection is possible. You might have seen some diabetic patients injecting themselves with insulin. So insulin is given by that subcutaneous tissue, and the diabetic people themselves inject with this insulin. But there are certain disadvantages as well, and these disadvantages include irritant drugs cannot be given by this subcutaneous route. Why? Because subcutaneous area has lot of nerve fibers, and this can be very painful if irritant drugs are given. Second, it is slowly absorbed. Okay, slower absorption is there. So if you want fast response like in emergency condition, this route is not used, and it should not be used in patients of shock. Why? Because in shock patients there is vasoconstriction. So superficially also there will be vasoconstriction, and hardly there will be any blood supply to the skin. Skin is actually pale in the shock patients. So the drug will not be able to enter into the circulation. Hardly there will be any action of the drug. So that is about the subcutaneous route. Moving on to the next route, that is the intramuscular route. So intramuscular route, what is the region? You can give it in large muscles of the body like deltoid. Okay, you know the shoulder region where the injection is given, gluteus maximus, that is the muscle of the hips. Okay, so intramuscular injection is given in large muscles, and for this the syringe is kept at 90 degrees, and then the injection is given directly into the muscle. And dosage forms of these include either solutions can be given, aqueous solutions, and even suspensions can be given. And for these also depot preparations are available. Okay, so depot preparations means again the drug can slowly enter into the circulation. What are the advantages of this route of administration? First, mild irritants can be given. Okay, subcutaneous we saw that irritant drugs cannot be given. In this, mild irritant drugs can be given, and this route is more vascular compared to subcutaneous route. More vascular compared to subcutaneous route. So subcutaneous, it is much slower absorption into the vessel. Intramuscular is little bit faster than the subcutaneous route. What are the disadvantages? Self-injection is not possible. It is impractical, and it is avoided in patients who are on anticoagulants. Anticoagulants are the drugs which prevent the coagulation of the blood. So if these patients are given these drugs, it can result in hematoma formation. Okay, so that was about the intramuscular route. Then moving on to intradermal route. So intradermal route, that is, it is just below the epidermis. Okay, so we have seen in the previous diagram that there are two layers of the skin, that is epidermis and then there is dermis. So intradermal route is where just below the epidermis the injection is given, and this is mainly used for testing, not for drug delivery. And in epidermis, because the area is very small, only very small volume can be injected, only 0.1 ml. Even in subcutaneous route, the space is very less. So approximately 0.5 to 1 ml amount of drug only can be given for subcutaneous route. If the drug volume which has to be given is more, then we don't give by subcutaneous route. Okay. So for epidermis, it is only 0.1 ml. So that is very less. That is why this intradermal route is given only for testing for certain drugs, and there is very slow absorption from epidermis into the circulation. Okay. So intradermal route is not used for therapeutics. It is mainly used for drug testing. For example, testing for allergens, that is the allergy testing, whether the person is sensitive to certain allergens or not. For that, the allergen can be injected, very small amount can be injected between epidermis and dermis, and we see the local changes what are happening in the skin. Okay, so that was about the intradermal route. Just 1 minute we will see the diagram as well to see that how the injection is given. So you see here for the intradermal route, that superficially it is given, so the syringe is like almost horizontal to the skin, so only at 10 to 15 degrees to the skin, and the intradermal injection is given. Now moving on to the other routes, that is the inhalation route, nasal route and cutaneous routes. So those are the non-injectable routes. By inhalation routes, the person is taking the drug, inhaling the drug, and it is going directly into the alveoli. Now, there is huge circulation in the lung. Whole pulmonary circulation goes to the lung, and hence from this alveoli, the drug enters into the pulmonary circulation and goes into the systemic circulation. So, it is very fast. It is very fast. So, because there is so much blood supply, the drug rapidly goes into the circulation. And one example of use of this inhalation route is for general anesthesia. So volatile liquids and gases can be used for this, which can be inhaled. So general anesthesia, one example of use of this route. And as soon as the person inhales, very fast the anesthetics start acting. Secondly, as soon as the inhalation is stopped, as soon as the mask is removed, what happens? The drug will diffuse back from the circulation into the alveoli. So termination of the action is also fast. Okay, so start of the action is fast, termination of action is also fast. So the administration can be very well controlled. Disadvantage is like irritant vapors can cause inflammation of the respiratory tract, and they can cause secretions which can be harmful also for the patient. Then next is nasal route. In nasal route, certain drugs like GnRH agonist, desmopressin can be used, and in this, the drug is absorbed directly from the blood supply of the nose. It is not local action. Please remember this. It is not local action. We are talking about the absorption of the drug into the circulation from the nasal mucosa. Okay. Then finally, we have the transdermal route. For transdermal route, actually there are certain patches available which are placed on the skin. And where in the skin can be placed? They are placed either on chest, abdomen, back, upper arm, buttock, or in mastoid region behind the ear. Basically in areas where there is not much movement, otherwise the patch will get removed. Okay, and slowly the drug is absorbed from this transdermal patch into the circulation. And it's a very convenient way of delivering the drug, and we get a smooth plasma concentration. We don't get much fluctuations in the level of the drug, but the plasma concentration remains sustained at a particular level till the transdermal patch has the drug. So there is a particular period. For example, the drug needs to be replaced in 3 days or in a week, like that. Then what can be the disadvantages? Disadvantages include that there is slow onset of action. Okay, because the drug will slowly enter into the circulation. Then only certain drugs which are lipophilic, they should be able to cross the membrane, isn't it? So only those can be delivered by transdermal route. Then there can be variable absorption also, though we get a smooth plasma concentration, but it can vary from person to person. Then with that, there can be local irritation and erythema as well. In that case, we need to change the site where the patch has been placed. So those were the different parenteral routes of drug administration. As always, the notes for this pharmacology video are available for free download from the app. Thanks for watching the video. If you liked it, do press the like button, do share the video with others, and don't forget to subscribe to the channel Physiology Open. Thank you.